Hi everyone, my name is Veronica Mokori and popularly known as Nurse-V. I welcome you all to another episode of Health Chat with Nurse-V. I am the founder of Health Chat with Nurse-V and I'm delighted to be your host today. Today we'll be talking about cervical cancer. But first of all, before we begin, I want to say a very big thank you to all of our global partners and all of our team members who are working tirelessly behind the camera. Thank you so much for being a source of incredible support to us. We are grateful. For those of us who are just joining in for the first time, this is Health Chat with Nurse-V, a dedicated platform for bringing insights into women's health. We discuss everything women's health, ranging from physical, psychological, mental, emotional, and our social well-being. And on the show today is a very admirable woman. She is Dr. Valla Daniel Waziri. She is a doctor from the Modibo Adama University Teaching Hospital, Yola, a member of the West African College of Surgeons and a senior registrar from the Obstetrics and Gynecology Department from the Modibo Adama University Teaching Hospital, Yola. She is the coordinator, Young Doctors Forum of Medical Women Association of Nigeria and the Adamawa State Coordinator, Youth Arm of Nigeria Cancer Society. Everyone, with a standing ovation from your house, please make welcome with me Dr. Valla Daniel Waziri. You're welcome on the show, ma.
Thank you, Nurse Vero. Thank you for having me.
You are very welcome. And on the show today, we are discussing a very important topic, which is cervical cancer. I know a lot of people might just have been hearing about cervical cancer, and it's on the surface, they don't really know what cervical cancer is. That's why on the show today, we've decided to bring you everything in detail that you need to know about cervical cancer. So to start with, ma, what are the common signs and symptoms of cervical cancer?
The most common symptoms that patients present with is postcoital bleeding.
Okay.
So, but women that tend to have postcoital bleeding are very few among the ones that present. It's the postcoital bleeding is usually the earliest sign that women present with. However, majority of women present late. So they present with advanced disease, having already a mass within the vagina descending from the cervix, and then that makes them have abnormal vaginal discharge that is foul smelling and watery. Some of them have also vaginal bleeding. Some can bleed in between their periods, and then some of them, even with the abnormal vaginal discharge, some still pass fleshy materials, necrotic tissues from the cervical mass. However, some present with vague symptoms like just back pain, weight loss. Some even have problem with passing feces or passing urine from the mass compressing the ureters, compressing the rectum, making it difficult for them to move their bowels, and then it also pass urine. So these are just the common symptoms.
Yes, so what exactly is cervical cancer to a layman?
Okay, cervical cancer is cancer of the cervix. So to a layman, that's the cancer of the mouth of the womb. That's the simplest way I can define that. And like we all know, cancer usually is just an abnormal growth. Yes. Even though not all growths are cancers, but in the case of cancer, you see, normally our body produces cells, and then when those cells are no longer in use, they tend to die with a process known as apoptosis, which is programmed cell death. However, in the case of cancers, these cells, even when the cells are not normal, the cells are destroyed, they continue to multiply in thousands, in billions, and that now forms that tumor. However, like I said, not every tumor, not every swelling you see is a cancer, but every form of cancer is an abnormal growth. And then the only way to differentiate cancer from not a cancer from a known cancer tumor is by biopsy.
Okay, yes, true biopsy. It's very important that every woman then needs to know what a cervix is. A lot of women, I think that's the next topic we're going to be talking about in health child nursing. You know, some of these are body organs. Some women don't even really know what they are. The cervix is after the vagina, and it's important that we also know that the vaginal opening is not the vagina. That's just the vaginal opening. Then after the vaginal opening is the vagina, and then the cervix, which looks like a mouth before the opening of our womb. So when we are talking cervical cancer, it means that there's an abnormal growth at that neck, that mouth of the womb. Is that clear? Now, what are the causes of cervical cancer? What exactly is the cause of cervical cancer?
So for cervical cancer, unlike other cancers where the exact cause is usually unknown in majority of cancers, in cervical cancer, it has been linked to a virus known as the human papilloma virus.
Yeah.
Yes, and so it's the organism that has been implicated in cervical cancer, and then this virus is sexually transmitted.
Wow.
Yes.
Okay.
So
the virus is sexually transmitted. We need to reiterate that. So is cervical cancer treatable?
Yes. That's for women who present early. Even though in our environment, majority of women tend to present late. But when women present with early stage disease, I mean, it's 100% curable.
Easier,
it's a cancer that it's 100% curable and preventable. However, majority of women tend to present with advanced disease where there's little
or nothing that can be done.
Per se in our environment. However, for those ones that can afford it, they tend to receive care.
Okay.
Yes.
So we are saying now that cervical cancer, when it is presented early, can be treated.
Yes.
But what if the person notices cervical cancer late? Is there any cure for it?
Well, it still depends on the stage.
Okay.
For some stages of the disease, we normally offer treatments like radiotherapy, chemotherapy. That's for some of the advanced disease, but for some, when they come, all we offer is palliative care just to improve their quality of life. And then, yes, but for those ones that present early, they tend to receive good and 100% cure.
Okay. Yes. So now, what exactly is the role of screening in cervical cancer prevention? First of all, can it be prevented?
Yes, cervical cancer can be prevented. It's one of the cancers that can be 100% prevented. Unlike the other cancers, since there's a known cause, the human papilloma virus, like I said, is sexually transmitted, so it can be prevented. And so, how do we prevent it? Health education should be the first step, like what you're doing, enlightening the public about this. People need to know that there's something like cervical cancer, okay, and they need to know how it is acquired, how it can be prevented, because if people are not informed, ignorance is not an excuse. Really.
Not at all. In 21st century,
whether you know it or you don't know it, if it will come, it will come.
Yeah.
So that's just how it is. So it can be prevented. Yes, health education. Let people know this. Let people even know there's a disease called cervical cancer. Let them know that it is sexually transmitted. Let them know all the risk factors that are associated with acquiring the disease. Then the next, after education, you vaccinate the public.
Okay.
Especially now. Now, I think even Nigeria have started the vaccination of young girls between the ages of 9 to 13. Some do up to 14. So vaccination. There are several vaccines out there, and I mean in Nigeria it's free. When we had the vaccine back then in school, I think it was 5,000 per dose. But currently, I think they're giving it out for free for these young girls, even though there are so many myths surrounding the vaccine, but it's out there. They're giving it for free. So encourage your girls. Let's not deprive our girls from
access to this vaccine.
So another thing again is early diagnosis. So how do we make the diagnosis early? Through screening. There's something we call pap smear or HPV DNA, where we take specimen from the mouth of the womb and then we take it for
Screening.
histology, where it will be checked to know if there's any abnormal cell at that cervix. So when the disease is diagnosed early, like I said, it can be cured, 100% cured.
Okay.
Yes. And then, so we encourage people, for those ones that are going to be screened using the pap smear, they should do it every 3 years, while for the HPV DNA every 5 years. That's it.
So at what age should a woman start this screening?
It's usually age 21, regardless of the age at polytechnic, regardless of when the woman starts having sex. But usually it is encouraged 3 years after the woman begins having sexual intercourse. For those kind of women, they should be screened. So it used to be assumed that most women begin having sex at the age of 18. But it's no longer like that. We have young girls of the age of 13, even like having sex now. So we encourage people 3 years after to commence screening. However, the ideal age is 21 for pap smear, while for HPV DNA, we prefer above 30 to be screened.
Okay, so what about women who have not started having sexual intercourse? Should they still be able to go for the HPV screening?
It's not necessary because, like I said, it's sexually transmitted. Yes.
Okay.
So for someone who is not sexually active, that may not be necessary.
Okay.
Yes, but they can be offered the vaccine.
Okay.
In fact, that's the aim. They should have it between the age of 8 and 14 before they start having the sexual intercourse. So that's the aim, the whole aim of that age range. So screening may not be appropriate for them, but they can be offered vaccine.
Okay, so it's very important that we note that screening for every woman who has started having sexual intercourse should happen after 3 years that you started having sexual intercourse. But if you have not started having sexual intercourse, it's very important that you go and have yourself vaccinated. However, you said from 21 years is appropriate for anyone to go for the screening.
Yes.
So what are the risk factors of cervical cancer? What are those things that predisposes one to cervical cancer?
Okay, so I've said it's earlier, it's sexually transmitted. So the first and most important is our sexual behavior. So early age at polytechnic, when a woman begins having sex very early marriage, having multiple children, and then having multiple sexual partners too is also another risk factor. And then sometimes you can see even women who have just one sexual partner who has many sexual partners. So a woman who has one, who is just sharing her husband, and then the husband is out there with multiple sexual partners, is also at risk. Then another risk factor is age. With increasing age, women are at risk. In fact, the first risk factor is being a woman. Every woman who has a cervix is at risk. Yes. Then with increasing age is also another risk factor. Then family history of cervical cancer or any cancer, especially the
from the reproductive health.
Yes. Perspective of I think we now stop. Okay, so just anyone family history of cancer. Then also another risk factor is smoking. Smoking tends to weaken the Langerhans cells at the cervix, and then reducing the immunity, so their body is unable to clear this virus from the cervix. Then also another is immunosuppression. Either when somebody is HIV positive, or if for women who are exposed to using corticosteroids for a very long time, it's also another risk factor for them. Their immune system is not strong enough to clear off the infection. It's important, I want us to understand something. For the HPV, human papilloma virus, virtually every woman that is sexually active acquires that virus at one point or the other in her life. Yes. But for women who have very good and strong immunity, they tend to clear the virus over time. Majority of women, about 80 to 85%, clear of the virus. Then a few percentage now persist and form the cancer. So if you look at it, that's why for women that are HIV positive, that the immunity is suppressed, their body is unable to clear out the virus, so it persists, and then it can progress to cancer in some of them.
Okay, it's very important that I think statistics has this, that smoking is the number one predisposing factor for various cancers.
Yes.
So it's very important, and there's what we call partial smoking. You may not be smoking yourself, but you hang around where people who are smoking are, and you keep inhaling the same thing that they are doing. You may not be the one smoking it, but you are invariably also a smoker. So please, if there's anybody smoking around you, desist and move away from them. All right, Ma, do you have anything you want to tell us that we've not asked about cervical cancer?
I think pretty much you have asked everything, but maybe I should just talk briefly on the burden of cervical cancer.
Okay, how common is it?
So globally, cervical cancer is the fourth most common cancer in women. Fourth. However, in Nigeria, in sub-Saharan Africa and Nigeria, it is the second most common cancer after breast cancer. Yes, and then the burden is more in these regions because I don't know, I think probably because of our poor health seeking behaviors, where women, especially in northern Nigeria, I've noticed something. Women are reserved, they are withdrawn, so they tend not to seek help early. They tend to present late when there's really little or nothing that can be done about the cancer. So it's, I don't know, I think in Africans generally, or should I say Nigeria generally, we have poor health seeking behavior, and then there are so many myths surrounding cervical cancer and then its vaccination. People will tell you if you have cancer or cervical cancer in general, in particular, I've heard that they tell you, if you come to the hospital and they give you injection, you just die. I mean, all those things are not true. They are not true. And people need to know these things. They are not true. That coming to the hospital will kill you from the disease. No. If you come to the hospital, we will help you, offer you help. So we need to debunk all of this myths. Some people will tell you, having cervical cancer from all those, if you use what do you call it? There's this salt water. It's what causes it, and all. No, the causative agent is human papillomavirus. So we want people to truly get to understand and know these things, because truly, whether you know it or not, like I said earlier, if the cancer wants to come, it will come. If sickness wants to come, it will come, regardless of whether you know that or not. Then I also want us to understand that what we see in the hospital is just, I think, the tip of the iceberg. Majority of people that are actually suffering from these things don't even come to the hospital.
In our villages,
money. Yes, I think poverty,
lack of awareness.
Yes. People are not aware. Then there's poverty. Even if people are aware and want to seek help, how many of them can afford? Especially the cost of treatment of cancer is really, really expensive. And then we have, I think the insurance services. Yes, we have several insurance services, but how many people have access to these things? People who truly need these things don't have access to them. So that's possibly part of the reason. And then even when they come, I mean, you can imagine the whole of the Northeast, we only have, I think, about 2 centers that offer radiotherapy, Borno and Gombe. So you can imagine, even when they come with late disease, there's really, we refer them to these facilities.
How many of them really go?
How many of them can afford radiotherapy? You are looking at the cost of treatment in government hospitals, sometimes up to 2 million naira. How many people can afford that? Yes, and then if you go to private hospitals, you even tend to spend more than that. So I think these are some of the myths, some of the things that I want us to understand. And then so for those women who have the advanced disease, yes, even if you think your disease is advanced, I mean, it's not a death sentence. Still come seek for help. We will offer what we can and then refer if need be. Come seek for help. It's not a death sentence. Really. There's so much that can be done. And then I want to re-emphasize screening and vaccination.
Mm-hmm.
And every woman, honestly, should try as much as possible to get herself screened if you're sexually active. And then let's not deprive our children from getting access to these vaccines. Yes.
Okay, is cervical cancer transmittable? If you live close to someone who has cervical cancer, can she be able to pass it? Is it a communicable disease?
No, it's not a communicable disease.
Okay.
Like I said, it's acquired through sexual contact. Yes.
All right. Thank you so much, Ma, for coming on the show. We are very grateful. It's very important out there that we take particular note of these things. Cervical cancer is not a death sentence. If you already have it, please come to the hospital and seek help. And if you haven't, please take screening seriously. If you are from the age of 21 years as a woman, you should begin to seek help for cervical screening. And if you've started having sexual intercourse very early, it is important that 3 years after you started having sexual intercourse, please take out time to visit the hospital and get yourself screened. And then our younger girls in the society, vaccinations is actually required for you. Vaccines are available outside. Tell your mom if she's not aware. And if you are a mom and you are aware of this, please make sure that you get your daughter vaccinated. The age range for vaccination is between 9 and 13 years. All right, thank you so much everyone for coming on the show. Once again, this is Health Chat with Nurse V, a dedicated platform where we bring insightful discussions into women's health. We do this because we know that there is a gap between knowledge that people have out there about women's health, and we believe that if we can pass this message out there, we believe that since ignorance is not an excuse, we will bring this information down to your doorstep. And it's very important that when you get this information, you seek for help very early. Don't forget to like this page, share, comment, and let's reach a wider audience. Thank you everyone once more for joining on the show today.